Mm-hmm.
All right. So I think we're officially on Facebook Live. So my name is Elise Bortolato. I'm with the Emerging Enterprise Center, a nonprofit business incubator, part of the Newcastle County Chamber of Commerce. And we're excited to be talking today with Jennifer Reed and Ann Weaver, part of Cornerstone Health Partners. They're actually one of our clients here at the Emerging Enterprise Incubator. And so it's exciting not just to hear their startup story, but just wanted to show that they're also a close partner with us. So to get started, just to kind of set the stage for everyone, can you just share just a quick background about what Cornerstone Health Partners is?
Sure. We are a in-home care, companionship, non-emergency transportation, care plan consulting. That's what our company does. It was started in 2017 by Adrienne McCullough. She started Cornerstone Health Partners after caring for her family members and just seeing the need for quality in-home care and support to people like you and I who have careers and families, but have aging parents that have medical needs. And so that was, the beginning of Cornerstone Health Partners, and she built this beautiful platform, and we are continuing it today.
Mm-hmm. Wonderful. And just to kind of give a little bit, I like to know kind of a little bit more about the people behind the business. The business is important. It's part of the story, but kind of what led you there. So, how did you meet Adrienne?
We knew each other socially for probably 15 years. And it's funny, it was Facebook that I was watching her post about her company, and it really kind of piqued my interest. My background, my advanced degrees are in social work and counseling. And I just, I have 5 children of my own, and most of which are grown. I just have one left at home, but I was just kind of seeing where my life was going and thought, oh, I should meet with her. We should talk about this. And we met over lunch. And at that time, Adrienne was battling cancer. However, you'd never know it. I mean, the energy she, had all the time. But so we talked, and we just had so many things that we agreed upon. And from that day, we just had this, we started to plan moving forward.
Are you guys both from Delaware area? Did you guys grow up here?
No, neither of us, nor myself. No. I grew up in a rural town in southeastern Massachusetts called Acushnet, where really the only thing you would know about that town is that's where they make Titleist golf balls. So
I grew up in Westchester in Pennsylvania, so I'm a transplant to Delaware as well. Been here probably about 8 years now.
Oh, nice. Okay. So that kind of also part of your story, like how you guys got into this field is based on a lot of things about your background and where you grew up and what kind of brought you to this, wanting to go into healthcare, and not just healthcare field or industry. It's helping families get through a lot of the healthcare industry.
Sure. Right. Absolutely. I'm one of 9. I come from a big family, in Massachusetts, and my parents were always caretaking kind of people. So that's probably where just, organically I get that from. And then having, my, advanced degrees in counseling, it was just it lent itself nicely to this line of work. Mm-hmm. And Jennifer.
Yeah, I mean, I've been a nurse since 2001. I've worked in many different fields, but came to home care about 7 years ago and fell in love with it and never wanted to leave. So I was at my previous job, and actually Adrienne recruited me to come help them out part-time. And that's how I got here. I knew Adrienne and socially as well. So we kind of all were in her little circle, and now here we are.
It's interesting because your backgrounds are aligned perfectly with what you guys are doing. Having a nursing background, understanding that portion, and then having a social work background, understanding those portions. So I always find it interesting to see how people get where they are.
Yes.
So I know that we have all had to pivot dramatically. Is there anything that you guys have? How's your company changed since the pandemic? How have you pivoted? What can people look forward to with your company?
Sure. In-home care is become even more important through this time with COVID. We're trying to keep people out of facilities and at home with their families. And so Molly Hayes is not here with us today, but she's another one of our clinical directors, has spent so much time making sure that all of our employees have the correct PPE. Every home that we service has everything that we need to keep them safe. We really have spent a lot of time making sure that Cornerstone Health Partners is providing the best possible care.
Have you learned anything through the pivoting that you guys maybe weren't expecting about either how you help your clients, the healthcare industry? Is there anything you kind of learned or take away from this moment?
Sure. One of the biggest things here in Delaware is the Department of Health and Social Services. They are the umbrella for all of us who do in-home care. And they have been an incredible resource for us through this time, always taking calls from us, always giving us guidance and counsel about how to give the best possible care. And we are. I really feel confident that, just based on our numbers, I mean, we, have just in the last couple of weeks, Jen, since going through our licensure process with the Department of Health and Social Services, the word of mouth, gets out. And I think people are just feeling that confidence from us.
Right.
That's good. And I know that funding is always not just during the pandemic, funding has always been on the minds of anyone who's starting a business, running a business, growing a business. So what is it you guys can share about either how Adrienne, I don't know how she bootstrapped the business. Was there funding kind of in place? Do you know anything about the start of this company?
Yes. So the initial startup, Adrienne, did on her own. And then going forward, she and I always were very conscious of running Cornerstone debt-free. We were very proud of that fact. And being here at the EEC, they have made it so possible for us to grow without debt. Of course, the pandemic, has put a wrinkle in our non-emergency transportation side. Prior to the pandemic, we were providing transportation to PACE Rehab, which was a wonderful, partnership for both them and us. So we had to shut down that part of our business until, the state reopens that phase. Because right now, all of the counseling through PACE is telemed.
It's all online. So we, just to briefly touch on that, we do work with the community of those suffering from addiction, alcohol and drugs. So that is how we got involved with PACE, and that's what they are. They're an outpatient rehab center for addiction and counseling. So we were very proud to work with them, and we're really hoping that once this pandemic is over, that we can, have that partnership back with them. As far as funding right now for COVID, I know that there were tons of things that came out right in the beginning, first being the PPE. I think that maybe we were one of the first to apply because I was nervous and I just wanted to get it done. So we did get funding from them initially. That really helped us pay our employees because, the client hours somewhat dropped when COVID initially came out because they were scared, which we totally understand, but we wanted to be able to still support our staff. So the PPE did that for us, kept all of our wonderful staff with us. We didn't lose anyone. Yes. And then going forward, all of the grants now that have come out through Delaware, through the CARES Act, through the Small Business Association, we just got a grant from oh my goodness, the Delaware CARES Act.
Mm-hmm.
So we did just receive that money. We found out this morning we also received the grant from the small business.
Great.
And then I applied for the other grant for healthcare through the Delaware CARES Act. So we're on it. You know, anything that comes out, we definitely are trying, because any money can help us right now, because we want to stay debt free.
Yep, that's great. And have you guys at all pivoted to doing telecare with any of your in-home patients, or no?
No, our patients require us to be in their homes caring for them physically.
Got it.
Yeah. Mm-hmm.
And do you guys have, you know, with I think outside of pivoting during the pandemic, your company has had to pivot with the loss of Adrian. What's kind of been the biggest challenge or moment that you've had that kind of, since, you know, a lot of businesses might have to go through this, you know, is there anything you learned from that kind of major change in your company? How do you handled it? What you would suggest to other companies who potentially have to go or will go through something like this? Is there anything you've learned through that kind of challenging time?
When Adrian left us in March, I just thought, oh my gosh, I cannot do this without her. You know, she was just such a force. You know, she passionately believed in Cornerstone, and, you know, being a patient herself going through cancer treatment, she really had a heart. She really understood every client that we serviced. But as I look back on it now, you know, she's always been cheering me on. She always would tell me how proud she was of how far we'd come. And so that momentum we've continued. I can just see you know, I see her and I'm so proud of you, Annie. I know, you know, you can do this. You can do this. And those who know Adrian, that is such her personality. She's such a cheerleader, and that's what's carried us through.
I mean, you carried on her legacy even through the pandemic. So, I mean, you were really hit with something very hard in your business, and then you were hit on top of that, not just the internal pieces of your business that were like kind of hit hard, but you had the pandemic and you had to really come together. So I also commend you guys. I think
we cried a lot.
Yeah, I'm tearing up.
We cried a lot.
Me and Bob have talked about, you know, you guys have taken on an extraordinary amount with everything during the pandemic, and you have persevered, which just goes to show, you know, how much you really do want to carry on that legacy and make sure that her work is continued, and it's important. So with that, is there any kind of, if you were to put your finger just on something you feel like has really helped the momentum of the business, if there was one thing you could just say, this is one thing we've done or continue to do that really has increased the momentum of our business, and continued going that path forward, what would it be?
It is the absolute leadership team that Adrian and I put together before she left us. You know, we hired Jen Reed, and then we hired Molly Hayes, who again is not here, but
she's in the field working.
She's in the field.
Add that she is working in the field today, covering a client.
But it is because of, you know, the two of them supporting me that we have been able to be there for each other, lifting each other up, reminding each other, why are we here? You know, reminding ourselves, you know, what we're doing is so important every day. And so, and hearing Adrian, and, you know, in our
ears and our minds, for sure, our hearts. Yeah.
Was there was there anything, when you hired the leadership team, I mean, you really did kind of have a diverse background of like nursing. I don't know what Molly's background is, but was there something you look for to complement that team and make it whole?
So in the state of Delaware, it is required to have a clinical director who needs to be at least an RN, but Jennifer has had 7 years of in-home care experience. So between Jennifer's in-home care experience and Molly Hayes, who had 10 years of neuro ICU experience, they have just been a tremendous asset to Cornerstone Health Partners.
That's good for other people to know, is to find, you know, if you are going to starting a business, you know, finding those potential hires that have that experience to bring to your business from different perspectives of the industries. So with that, is there any like best advice that you've received being a business owner, or would you want to give out to other business owners?
Sure, yes. One of the things Adrienne and I did was we spent a lot of time interviewing other business owners, even if they were no longer working in that line, retired. And something very important that they said to us, which was kind of like a resonating point, was that for she and I to stay in our own lanes, like decide what parts of the business were our strengths, and then to stay in those lanes. And that was something that Adrienne and I really defined, was what each of us were good at. And then supporting each other through those, areas. But then, when we knew how, she was getting sicker and sicker, we knew it was important for us to find Jen Reed and Molly Hayes to fit those parts that she was going to no longer be able to fulfill. And the other thing was like, what sets Cornerstone apart from every other in-home care company? Why are we different? And that was another point that we, that we had received from other business owners. And so we've made a pointed effort to make ourselves different. And, Jennifer and Molly have really, really been big part of that going forward.
What do you think those differentiation factors are?
So I'll take that one. There's so many home cares out there, so many amazing home cares, very large companies, throughout the United States. Adrienne's wish and, our continuing her legacy, we do believe that we don't want to be huge and magnificent. We want to stay a nice, small, little, home care company. And, that the reason for that is we feel that if we got too big, that we would not be able to provide the quality of care that we currently do. We really push on quality of care, the right employees being with the clients. We try and match them up and have them there, the continuity of care, excuse me. And then, also aside from us just being in the home with the home health aides, we have Molly and myself who, are the nurses, and we provide, counseling for them, care plan. We have family meetings, kind of as like a mediator, a go-between. And we want to be able to continue to do that. So we don't want to grow and be very large. It would be great, but, in our hearts and our minds, we really want to stay small, and we want to really be able to continue the quality of care that we do provide. And that would be different from possibly other larger home care companies.
That really kind of high touch, personalized piece.
Yes.
It does matter, especially when our families are going through probably part of the hardest parts of their life. I mean, these are going to be, you're dealing with families with going through the most difficult, challenging parts of their life and their families. So with that, if there's anyone tuning in, where would they learn more about your company, maybe getting some questions answered, or if they're starting to plan for the future of maybe some loved ones that are aging, where could they reach out to you?
Our website is fantastic. It gives you a lot of information about who we are and what we do. And it also assists you in getting to us. It's very functional.
Yep, there's links in there to contact us. There's links in there to send us emails or questions. The other way, they can always just make a phone call. It's 302-317-3040. They can, I think a lot of people prefer to do it over the phone, and that is totally fine with us. It's more personal that way. Again, going along with that, we like to meet in person with people as well, because we feel like that's a better personal touch. Even with COVID, we're safe, but I feel like the phone call and the website would be the best ways to get a hold of us. And honestly, we're here 24/7 to answer questions. We provide care 24/7, so we're here for anyone that needs even just to talk to somebody.
Wonderful.
Yeah.
And for those who are looking at where their website is, I had it listed in the description, which is mycph.org, right? Cornerstone Health.
CHP, Cornerstone Health Partners.
CHP, sorry, mychp.org, which is also in the description, so don't listen to what I said. And then I just wanted to thank you guys again for sitting down and talking to us. I know you guys have had an extraordinary few months, and you have done extraordinary work in those few months. So thank you guys for being part of the EEC. And we do, look forward to seeing where your business grows. So thank you all.
Thank you for having us.
All right. Bye,
All
guys.
right, thank you.
Bye.
Bye-bye.